think it says recording. Oh, now I'm getting are you all getting feedback?
It says recording has started.
Okay, great.
Yeah.
All right. Well, thank you everyone for joining us for this recording of Creek Conversations. I'm Eliza McLaren, Associate Head of School at Indian Creek, and we're recording this on October 1st and with the intention of sharing it with faculty tomorrow, Friday, and with our larger community early next week. Today marked the first day of Mod 2 at Indian Creek, which was exciting. We're well into hybrid half-day mode, and we're starting to look ahead towards offering a full-day option for our students. So that's in large part what our conversation is about tonight. We thought it would be helpful for everyone to hear from some of the experts who have been guiding the school's decision-making over the last many months. So we're here tonight for a conversation with some members of our medical advisory board, and of course with our head of school, Booth. So let's start just by introducing ourselves. Booth, over to you.
Hi everybody, Booth Kyle, school head. Very pleased you're tuning into this session.
I'll go next. My name is Leo Menendez, and I'm chairman of the Medical Advisory Committee. Just a little bit of background on myself. I'm a parent of two Creekers, class of 22 and class of 21, Michael and Nicholas. My background, I'm an oral and maxillofacial surgeon in private practice. I've been doing that for 25 years. And I'm glad this committee has been established so we can help our community kind of move forward in this COVID crisis.
Hi, everyone. I'm Anand Parikh. I'm a member of the Medical Advisory Committee. I also have two children at Indian Creek School, Isha and Anika, in 4th grade and 2nd grade, respectively. By background, I'm an internal medicine physician, and right now doing full-time healthcare policy work. Thanks. Great.
Well, thank you all for being here. We'll do this sort of in a informal conversation, question and answer format. Booth, I'll start with you. Can you just give us a little bit of background on the Medical Advisory Committee and how it formed and what its role has been in advising the school in decision making?
Sure, yeah, happy to. So when I think about the Medical Advisory Committee now, partly in hindsight, since we've been together for many months now, there's an alignment with our school mantra this year of learning together, and I can testify to the fact that I've learned a lot from being together with this group, and I think we've all learned a lot. You know, we've been feeling our way through the pandemic culture that we find ourselves in. So we first had the idea of having a medical advisory committee, I think probably last April. And Leo is a member of our board of trustees, and I kind of ran the idea by him. Another member of our medical advisory committee had been offering me some sort of unsolicited advice, which was very helpful. And it just kind of put the bug in my ear that we should get a group together. And Anand had reached out via email a couple times with some questions and also just offering his assistance. And that's how it came about. So the group is 5 physicians, all parents at Indian Creek. And at first we were meeting weekly, and then over the summer we met a little less often just to give everyone a little bit of a break. And then most recently we meet bi-weekly. Typically we have an agenda where we just run questions and concepts, you know, through the committee and receive their feedback. It's very always the same feedback from every doctor, and that's really helpful. And you know, the information that we get from each of the meetings just helps inform how we make our decisions. And many administrators and some of our internal medical staff are parts of various meetings. And I've just found it to be really helpful. And I'm so grateful that the 5 physicians have agreed to help us out this way.
I agree. It really is about learning together. It's always very interesting. So Leo and Anand, as we think about reopening schools and in particular about reopening Indian Creek, what were the considerations that you thought were most worth thinking about and just discussing? What protocols did you think implemented? And can you just talk us through some of those conversations around deciding how to reopen?
Well, I'll start, and then I'll have Anand follow. The first thing was, where are we in terms of our student population? Is our student population similar to the public school systems? Do we have the same numbers that the public school systems have? And the answer is no. We're a much smaller school, so we have a smaller population to kind of control and monitor. So that was an issue. That was on our side. That was a benefit on our side. And then the questions were, are our facilities appropriate to kind of control a population of our size? And the answer is yes. We have a very robust upper school with a lot of space and smaller class sizes. And our lower school is the same. We have a lot of space and smaller class sizes. So those are two positives that we share. And then it came into, okay, well then how do we kind of introduce our students back onto campus, and what do we need to do to kind of make it a safe entry into our campus? And we came up with screening protocols, the Magnus app. We came up with distancing protocols, and hygiene protocols and disinfecting protocols, and all those things are really designed to bring the kids back onto our campuses safely. And I think we're doing a good job, and we're evolving as we kind of move through bringing the kids back. We think of different ways to make it safer and bringing more kids back on the campus at the same time.
Yeah, I agree with Leo. The way I look at it, there are three factors that I think are critical when you make the decision about reopening schools. The first is you want to look at the baseline community transmission, and I'm sure we'll get into metrics in a little bit. The second is you want to make sure the school has those rules and protocols to reduce transmission. So we know this virus, the primary mode of transmission is through droplets. It's thought that these droplets travel about 6 feet. So that's why everything that the school can do and is doing related to physical distancing and wearing masks is so important. And so I think that was a consideration. I think realizing that these droplets could land anywhere it leads to the idea that we need to make sure that we have good policies for disinfection and hand hygiene and all of that. So that's another consideration. And then the emerging science tells us that there's likely some not only droplet transmission, but airborne transmission. And that's why this idea of ventilation, making the school has a good, proper ventilation system, cross ventilation, outdoor air, all of those things are important as well. So I think these are a lot of the things that we looked at. And then, of course, the third major factor is just all of us, the Indian Creek family and community and our pledging really to look after one another and make sure we make the right decisions and adhere, to the Magnus app. And, it takes all of us. So you really need all three of those things. I think the school's looking at community-wide transmission rates. They're looking at what they can do in terms of following rules and regulations, evidence-based rules and protocols. And then number three, making sure that the whole community understands that every action that we take affects someone else.
Thanks for that. And Anand, back to you with the next question. So you started mentioning metrics. What are the metrics that you follow most closely, that you think the school needs to follow most closely, and that our viewers, our community should be looking at? And also, how much weight do you put on those metrics in terms of a factor in our decision making?
So there are two particular metrics that I look at, and I'm sure that there are others. The first is testing. You know, if you can't test, you don't know where you are. And one of the best measures of whether we're testing enough is something called the positivity rate. Essentially, out of all the tests out there, what percentage are turning positive? And it's thought that if your positivity rate is over 5%, then that's an indicator of insufficient testing. So we have been really closely following that positivity rate for Anne Arundel County, but also adjacent counties, given that we know our student body comes from surrounding counties, as well as the positivity rate of the state more broadly. So I think that's the first indicator. Only when you know that there's sufficient testing do cases mean something. And so the second indicator then is the caseload. How many cases are being diagnosed out of a part of the population? So we look at essentially cases per 100,000 population. And we follow that pretty carefully as well for Anne Arundel County, adjacent counties, for Maryland as well. On any given day, these numbers are changing. So one of the things the Medical Advisory Committee continues to stress is let's follow trends, and let's not make judgments after 1 or 2 days, but let's follow it for a couple days, a week or two, so we're not making snap judgments. So I think it's looking at those metrics. They're important. A lot of the other metrics lag. So, you think about things like hospitalizations and others. Those are more lagging indicators. So we like to look at whether we're testing enough, and we like to look at cases, and we look and we look at trends.
And on that point, Anne Arundel County and the state overall has been doing pretty good for the last couple of weeks. We've been fairly steady with our positivity rate. Today is 2.88. We haven't really climbed over 3% in the last 2 weeks or so. And our cases per 100,000 has been, again, anywhere between 7, 8 per 100,000. So we've been pretty steady. We haven't really seen the spikes that we thought we would after Labor Day. And that really bodes well for our state, how we're following the protocols with using a mask, social distancing. So all that really lends itself well for our school and moving forward, opening the school more.
Great, thanks. We established over the summer, as we were thinking about reopening, this 4-color system with red, orange, yellow, and green. And we've talked a lot, and our thinking has evolved a bit on how we move from one phase to another. And I'm hopeful that you can provide some insight into that, how we and what we should be thinking about as we look to moving into our yellow phase from, right now we're in our hybrid orange phase following having been in orange. So what thoughts do you have there about what we should be considering in moving phases?
I think we're doing pretty good in kind of sticking to our script of moving between the phases. I think initially moving into the yellow phase, we were hoping for under 5% positivity rate and 5 to 8 cases per 100,000. Like I said, we're at 2.88 positivity rate, and our cases per 100,000 is anywhere from 7 to 8. But we have to keep that in mind, that that's a tool that we're using to guide us in our decisions. And we have to keep in mind that our school is unique. Like I said earlier, we have a smaller population. Our class sizes are smaller. Our 7th or 9th, 10th are 60 per grade on average. Our upper, our seniors are 50, 55, something like that. So we have a much smaller class size, and we have a larger facility that we can physically distance. So even though we're not meeting our initial goals with going into a yellow phase, we're close, and we're unique with our population and our infrastructure, our actual buildings.
Yeah, I agree. As I said, metrics are one of the 3. Metrics are really important, but they're just, one of the 3 stools. The other 2 are, does Creek have the right protocols? Are they evidence-based? And I think we do. And then number three, how is the community doing in terms of following, public health guidelines? And that's on all of us. Make sure that we're wearing masks in public, making sure that we're physically distancing on and off campus, weekends, hand hygiene, respiratory etiquette. So it's really the behavior of our community. It's the evidence-based protocols of the school, plus these metrics. It's all three of those. And I think the Medical Advisory Committee is really looking at all three of those holistically, and then making recommendations to Booth and team.
Eliza, can I just chime in there, just as the non-medical professional? But I think as an educator and administrator, my goal from the outset was to ensure that we at the school could deliver on our practices and protocols. And really, I probably didn't share this with too many people, but I wanted us to be the best. I wanted us to do it better than anybody. And I just had this thought that if we could aspire to that and deliver on it, we'd have a better shot at doing more on-campus instruction. And I think we've done a good job. I'm really proud of how our faculty and staff have embraced all the protocols, how the students have behaved. And it gives us that opportunity to think about progress. And all of it just really aligns with my sensibilities. I wanted to have the community have the opportunity to practice it all without before we jumped in with 2 feet. And I think from what I've seen, I said I'm proud, and I think we're ready to consider a move to more on-campus instruction.
Thanks, Bruce. I'll go from my role of questioner to commenter for just a second and add to that one of the phrases that we've used a lot starting this summer was just to move slowly and build confidence. And I think what Booth was just saying about making sure that we really master the protocols in the half-day mode before we move on to the full-day mode. I've been really proud of our community for committing to that and to moving slowly in that way. So thank you. Related to that, moving the biggest difference between the orange phase and the yellow phase is moving from a half-day model to a full-day model. What are the considerations there? What are the additional risk factors, and how do we feel that those are adequately mitigated as we move into that full-day model?
Well, right, optics is we're having more kids on campus. So, we're increasing our potential for contacts. Again, I go back to our plan. I think we have an excellent plan of how we're bringing the kids back on campus. We're not bringing everybody back at once. We're doing houses. We're separating the houses physically. Those houses are not on campus at the same time. There's breaks in between. I think that all goes with social distancing, keeping the kids apart, and then following the protocols, wearing masks, our small class sizes, our small overall volume of kids. I think that's in our favor to bring them all on campus.
And I would say that the second obvious risk and caution when you go from half day to full day are periods that you're introducing where kids aren't wearing masks. And by definition, when they're eating, during lunch and others, they're not going to be able to wear masks. Perhaps if young kids are napping, they're not going to be wearing masks. And right now, we are totally enforcing sort of a mask policy for all our students. So that's something that we're concerned about and we've discussed, and we're thinking through all the right sort of protocols to ensure there's physical distancing, there's ventilation, and exactly how to eat and perhaps nap, in a setting where you don't have masks and kids are together. So I think we're giving it, really serious thought, and I think there's some good ideas out there. But these are some of the issues that we're considering.
All right, thanks. Sort of a zooming out, larger picture question about COVID and what you're seeing. Can you talk just a little bit about what you're seeing on the landscape for this virus, where we are with it, your thoughts on what a vaccine might do for schooling in the near term or the long term? How are you feeling about it all these days?
I'll let Anand start. He's the public health expert, so I'll just follow him.
Yeah, I think it's a bit of a concerning time. We're going into the fall, colder weather. We're gonna be able to do less outside. We'll be more, inside, and there's just more indoor transmission. Everything we talk about in terms of hand hygiene, respiratory etiquette, wearing masks, physical distancing, that just gets so much more important, I think, during this time. Over the country, nationwide, unfortunately, cases are increasing in the majority of the states. I don't think Maryland is one of them. In some parts of the country, hospitalizations are increasing. And so, I think there are some concerns nationwide. Again, I think Maryland is one of the better states. We might not be like New England, where positivity rates are 1 or 2%, and case loads are 1 or 2 per 100,000, but we're certainly not like many sister states in the South or the West or the Midwest or Great Plains. So, we're going to have to keep up with this, because even if, and there will be, an approved vaccine, whether it's by the end of the year or not, at some point, there's so much good work done, we'll get a vaccine. But distribution of that vaccine will take quite a while. It'll take, frankly, most of 2021 or a good part of 2021 to get people vaccinated. And it'll take the whole next year to make sure that not only people get vaccinated, but in fact, it's having the effect that we want it to have to ensure we reach enough immunity in the population. So everything we're doing and we're talking about, all these best practices, we're going to have to continue these. We're going to have to continue these for a while. It's not like when a vaccine gets approved, we can just stop all of this, what we're doing, and say, all right, we're done, because we won't be done. So I think we have a long road ahead of us. But the only way I think we're successful is if we take it one step at a time. We follow the evidence, the science, the data, and it's an iterative process. If we see things not working, we pull back. And I think we have to be nimble enough, and on top of this, to stay ahead of it and not get behind.
And just to follow up on what Anand is saying, I agree. I think this virus is going to be with us for a while. To his point, numbers are increasing in the Midwest, where they were down earlier in the year. So it's kind of moving through the country. Yes, I believe there's going to be a vaccine, probably early 2021. Distribution, as he brought up, is going to be an issue. And then compliance, whether our families are going to want to take the vaccine, is another issue. I am hoping that we have a lesser flu season, because we've been using appropriate masks and hand hygiene. So I'm hopeful that we'll have a less virulent flu season this year. But nevertheless, this is going to be with us for a while. We're going to be social distancing. We're going to be doing hybrid models for a while. We can't be naive to think that we're not going to have certain local outbreaks in our school. So we're going to have to kind of be flexible to switch between the hybrid model and the all virtual model. But, as long as we kind of stick to our protocols and be smart, be responsive, I think we'll get through this. This will end at some point. We just have to be patient and have to kind of have the conviction that we want to keep our school open. We all believe that kids should be on campus, and that we're going to do everything we can to keep it safe. So I think we can do it.
If I can just echo one point Leo made, just maybe a public service announcement. Please get your flu shot. The flu shot is recommended for everyone over the age of 6 months in the United States. Let's take flu off the table this season for our community, for the Indian Creek community. The healthcare system has enough to deal with COVID-19. Getting the flu shot can help take flu off the table, help our staff at Indian Creek as well. So it's particularly important for everybody, for the kids, for the staff, for the faculty, for the parents. So I think that's really important.
You bet.
Thank you for that. So thinking back to our last meeting, which, gosh, was just a couple days ago, obviously we're really thinking mostly as a committee about yellow and yellow protocols, what it means to go to a full day model. But there are a couple of other topics on the horizon that came up, talking about testing, about holidays. You share some of your sort of preliminary thoughts on what the next topics we need to cover as a committee are, and what we're thinking about looking forward.
Well, obviously Thanksgiving's coming up, and that's a big family holiday where families get together, families travel, families are not social distancing. So we have to be smart with our decisions, what we do after Thanksgiving. I do not see it being completely wrong that we go virtual for 2 weeks following Thanksgiving. That way we just take that risk off the table. We don't require that our families bring their kids to the school. We just keep everybody home for 2 weeks. And then after 2 weeks, we can roll the hybrid model back in. We did well just the other day when we had to immediately flip to a virtual program when our online systems went down. So I think we have the protocols in place, and the teachers are well versed in virtual schooling. That if we appropriately plan, we can do something like just go virtual for 2 weeks. And we should use that sort of model for big events that we think are going to be a problem. That's a luxury we have, and we should utilize it and not put so much pressure on ourselves to, social distance, MagnaSat, temperature checks when we get back from Thanksgiving. Let's just go virtual, at least that's my opinion, for 2 weeks, and then jump back on it afterwards.
I agree with Leo. I would probably even go so far to saying I would not be surprised if in some period of the winter months that will be virtual for a while, particularly December, January, and February, those months where it's pretty cold and we're all indoors. And again, even if there's a approved vaccine, it's not going to be for kids. In fact, it hasn't even been tested on kids yet. And it'll first go to first responders, essential workers, and the elderly and those who have serious illness. So, the numbers, will likely get worse this winter, and I think we ought to be prepared for some virtual schooling during the winter months. And I guess it'll remain to be seen how long, for what duration. But I think that is a consideration. I think the other point that you mentioned that our committee will be discussing is the role of testing. And that's one thing that our school hasn't been doing. That's just because no school has been doing that, because there's been a shortage really of rapid tests. But it's likely that over the next few months in the United States, there's going to be a deployment of hundreds of millions of these rapid tests. So these are tests that you can quickly take, get results in a few minutes. Maryland will start to get their share, and we'll have to talk about, do we on a regular basis start testing portions of the faculty and staff and students. I think we're going to have to learn more about that. We're going to have to see what the guidance is from a lot of the public health authorities. We're going to have to see availability as well. We're going to have to see best practices. Some countries around the world, some schools do have testing, frequent testing of faculty and staff and students. So I think we're going to have to study all of that to determine, is that an additional safety piece that we should do, testing individuals who are asymptomatic on a regular basis, because that's really how you find asymptomatic cases, and that's a big part of COVID-19. There are a lot of people who have COVID-19 who have no symptoms. So the only way you can actually identify those people are if you test asymptomatic people, quickly identify, isolate them, quarantine their contact. That's how you reduce transmission. So I think that's another area that I think we'll probably be discussing.
Your answers there, guys, really just reminding me why it's so valuable to have the committee. You're able to look really far forward for the school. And I remember the other evening when you mentioned the rapid testing, it really got my wheels turning, and kind of reminded me of moment very early on in our time together. Back in the spring, I think our pediatrician on the committee mentioned the 3 Ws, and it was kind of like a bing light bulb moment for me. And it you know, I just hadn't heard that comment before, or that concept before. And of course, since then, everyone talks about it. But you know, hearing that kind of, having that kind of discourse in our committee meetings really gives us an advantage to think ahead, to do the proper planning, and to consequently make the right decisions.
The other thing that I was thinking about as you're looking towards the winter is, a good portion of our success in virtual school last spring was based on the connections that teachers and students formed in person over the year leading up to that. And I think that's what we know to be true about virtual schooling, is that you have to have that sense of connection, of relationship between teachers and students, and between students and students. So we have this window right now, and I certainly want us to take advantage of that as much as we can, to build those connections. As great as we are at virtual, nothing replaces face-to-face, and that's something I think we've all learned through this, is even more true. So that's one of the big motivators, I think, for us to try the full day model here in the coming weeks.
Agree.
Any last thoughts or comments or public service announcements for our community before we wrap it up?
I just want to say that I think our administrators, our teachers, the medical advisory committee, we're all doing everything, whatever we can, to bring the kids back on campus safely. And I think we're doing a very good job. I think everyone would agree that having the kids on campus is important. So I think discussions like this, the more we talk about it, just gives more information and just gives us the confidence that we're doing the right thing.
Yeah, I agree. I hope that this is an ongoing, continuing dialogue. You know, we want to hear from faculty and staff and parents and students, and you know, none of us individually have all the answers, but I think through conversations like this, open dialogue, we can make the best decision for the whole community.
We're learning together. We're really grateful for you guys. You know, thanks for lending your time to the school. It's so valuable. And I don't have any public service announcements, Eliza, besides thanking our doctors and thanking you for leading the discussion tonight.
Well, thank you. As always, I'll just shout out our teachers and thank them for everything they're doing to make this a reality for us. So, and of course, everyone watching, thanks for being here. All right. Good night.
Good night.
We'll do it again sometime. See you guys.
Thanks, Booth. Thanks, Leo.
Bye-bye.
Bye-bye.